Gradual versus abrupt smoking cessation, a randomised trial. For many people, the obvious way to quit smoking is to cut down gradually until they stop. In this trial, we showed that the obvious way, cutting down first, was a less successful way to quit than smoking as normal and then stopping. We know that more than half those who try to quit smoking do so by trying to cut down. After all, that's how we accomplish most goals that are hard. We gradually build up our training until we can run the marathon. With addictions other than smoking, we aim to get people to cut down gradually rather than stop abruptly. But with smoking, the notion of the quit day has become ingrained. Around the world, physicians and others who support smoking cessation help people to quit abruptly and not to cut down first. This is important because we know that getting help, behavioural support and medication increases the chances of success 3 or 4-fold. If physicians are not providing this support to people who want to quit by reduction, then they have less chance of success. On the other hand, if this method is a bad way to quit, then we need to persuade people to abandon their common sense idea and quit abruptly instead. To look at this, we recruited 700 people who wanted to quit smoking and split them into 2 equal groups. Both groups had a target quit day 2 weeks after they enrolled in the study. The reduction group tried to cut down their cigarette smoking by half during the first week and halve it again during the second week before quitting completely 2 weeks later. The abrupt group smoked as normal for 2 weeks and then tried to stop smoking completely after their quit date. We found that the abrupt group were 25% more likely to stop smoking than the group who tried cutting down first, both in the short term and in the long term. And this result was not affected by people's preferences. Most people thought that cutting down would suit them better. Fewer thought that stopping smoking would suit them better. But whatever they thought, it turned out they were better to try to quit abruptly and not by cutting down first. The difference seemed to arise because people struggled to cut down. It gave them extra work to do that seemed to put them off the idea of quitting completely. If people made a quit attempt, the success rates were equal, but fewer people made a quit attempt in the reduction arm. It's important to be clear about what these results mean. These were people who wanted to quit soon, who could set a quit date. For these people, smoking as normal and then having a quit day is definitely the best approach. Many people who smoke cannot imagine stopping smoking right now. For them, we know from other research that the best thing they can do is to try to cut down and use nicotine replacement to help the cutting down process. So, cutting down is good, but for those who can bring themselves to do it, quitting abruptly is better.